I was going for treatment for that headache. But for them, the first test they do is that HIV. Then I confirmed myself, I was shocked.
This happens when the HIV virus has caused enough damage in the body that now you are having a constellation of symptoms that are related to diminished immunity.
And in regards to reduction, I think we've made about 68% reduction.
Cervical cancer is basically an excessive overgrowth that involves the reproductive system of a woman.
It is the second leading cancers among women, and in Kenya particularly, it is second to breast cancer. Breast cancer is the most common, then cervical cancer is second in terms of incidence, in terms of occurrence.
Around 39 million people worldwide are living with HIV, and in Kenya alone, over 1.3 million individuals are affected by the virus. At the same time, cervical cancer remains the second most common cancer among women in Kenya, with nearly 5,000 new cases diagnosed each year. These numbers tell a story of urgency, but behind every statistic is a real person, a life forever changed by these diseases. In this special episode, we revisit the powerful stories of those who have faced HIV and cervical cancer head-on. Through the voices of patients and the insights of medical experts, we reflect on the realities of these diseases, their impact, the fight for treatment, and the power of prevention.
My name is Dr. Angie Guna. I'm a senior medical officer working at the MP Shah Hospital. I run the Family Medicine and Staff Clinic. HIV is a blood-borne virus. The difference between HIV and AIDS is acquired immunodeficiency syndrome. This happens when the HIV virus has caused enough damage in the body that now you are having a constellation of symptoms that are related to diminished immunity.
AIDS is the final and most severe stage of HIV, occurring after the virus has extensively damaged the body's immune system. In recent years, there has been a decline in the number of new cases.
When we look at new infections, we are coming from over 40,000 new infections to currently 22,000 new infections. So yes, we are making significant strides. And in regards to reduction, I think we've made about 68% reduction.
In this episode, one of the three ladies we interviewed, Rose, which is not her real name, shared her story.
I was living with my sister and I was working at a hotel. I had just completed my course, my diploma course on journalism. And then it was my routine. When I get ill, I go to hospital. I had an headache. I went to the hospital. I was going for treatment for that headache. But for them, the first test they do is that HIV. Then I confirmed myself, I was shocked. But they talked to me. I just agreed myself.
Receiving a HIV diagnosis can be overwhelming, often filled with shock, fear, and uncertainty about the future. When it comes to the transmission of HIV, it is often misunderstood, leading to the social exclusion of individuals living with the disease.
HIV is spread through bodily fluid that carry HIV.
Exposure to bodily fluids, which could be even through road accidents, shared sharp objects. And this happens a lot in boarding institutions, in the prisons, where people have to share commodities.
Rose eventually met a good man and kept her HIV status hidden throughout their courtship and marriage. However, when she became pregnant, she was faced with the difficult decision of revealing her status.
When I decided to get married, I got a man who weird. I didn't tell him the first time because I was just fearing. But we get married. I was just taking my ARVs without his consent. I get my first baby. Then I told those doctors, now what will I do, because this child must get out negative, and I don't want him to get out positive, and my husband doesn't know. Then I got a friend of mine, a doctor. Then she told me that nothing shall happen when it is your time to get your baby, you just come, get your baby, then you shall organize with your husband to come. You get tested, all of you, like you have never get tested. We went, get tested, is HIV negative, and I was positive. But before we get tested, we were cancelled and asked, even Marietta is positive, what shall you do as a man, as a husband? Then he said, I'm okay, I'll be okay with that. And then we got us tested. It came out negative. Then my status was positive. We were given, I was given his, and he was given my results. So he read, and I read his. But I thank God, nothing happened. And he said, this is my wife. I glorify God for that.
The symptoms of HIV vary depending on the disease progression.
Under 3 months after contracting it, which is called the window period, you might not show any symptoms. And even post the having detectable levels, which is post 3 months, then you have detectable levels of HIV in your body, so that when you test that time, after 3 months, it can show positive if you are. But in terms of clinical symptoms, they vary from when they show.
You can acquire HIV today and stay for 10 to 20 years without showing any symptoms, based on what you're eating, based on the privileges that you have. You can have HIV today and show it in the next 21 days.
So the initial ones, they are called flu-like symptoms. So the person might have a sore throat, lymphadenopathy where they have swollen lymph nodes. They can have a skin rash. You might have a fever. As it advances to different stages, it will go to stage 1, stage 2. Usually most patients are asymptomatic. So with stage 3 and stage 4 is now where we see the real symptoms. You can have oral candidiasis, esophageal candidiasis. We are going to have things like coccal meningitis, recurrent UTIs, urinary tract infections, some cancers, some skin, generalized body rash, cancers such as Kaposi's sarcoma, and TB, because now at stage 3 and stage 4, what we are now having is real immunosuppression. So any disease can attack the body now because the immune system is compromised, what we call opportunistic infections.
Next, we look at cervical cancer, which is closely linked to HIV.
Cervical cancer is basically an excessive overgrowth that involves the reproductive system of a woman, and mainly the lower part of the uterus, the birth canal, and that lower part of the uterus is called the cervix, commonly known as the cervical cancer.
Cervical cancer is a significant public health concern in Kenya.
Globally, it's not among the top 10 cancers. But when it comes to Africa, it is the second leading cancers among women, and in Kenya particularly, it is second to breast cancer. Breast cancer is the most common, then cervical cancer is second in terms of incidence, in terms of occurrence.
Mimi ni Joki Mbugua. Nimesurvive na hii ugonjwa tangu 2021. Sasa mimi wakati nigonjeka nilikuwa nagonjeka tu nikienda hospitali. Nikienda na napimiwa makojo, naambiwa niko na infection. Napewa madawa nikirudi. Wakaniambia ukimaliza hii urudi. Ninarudi, napewa ninarudi. Mpaka nikajiuliza kwani ni nini?
In this episode, Mary shared how she started having various symptoms that led her to several hospitals in search of solutions which she did not find. In a chance or perhaps a miracle encounter, she met Emma from the Women for Cancer Foundation.
Nikakaa na nikasema Mungu wewe ndio Mungu, ndio najua mambo yangu. Sasa ndio nisikia hiyo gari ya kina Emma. Nimetangaza nikaenda. Kwanza nilienda, shetani naye akanipinga kabisa. Kufika huko wakasema wamechoka, sasa imeenda. Mungu naye ni mwema, akakuja akatuambia kuna mtu alikuwa sua kupimwa. Tukamwambia ndio. Ndio akatuelekeza Muthaiga. Kaenda akatupimia Muthaiga. Baada ya siku 2 akanipigia simu. Vile amenipigia simu ndio niliogopa sana. Aliniambia, Mary, utaweza kutana na mimi Kenyatta Jumatano. Nikamwambia mimi siwezi kuja. Akaniuliza kwa nini? Nikamwambia mimi siwezi kuja juu najua Kenyatta ni pesa. Na mimi sina hela, hata nduru sina. Ndio alichukua jukumu akaniambia, kuja na hiyo fare uko nayo ili utapata huku. Ukuja akashughulikia.
Now, what are some of the symptoms for cervical cancer?
Strangely, cervical cancer could just be asymptomatic. One could be sitting on a tumor without symptoms initially. And to be specific, more commonly is having an abnormal vaginal discharge that one is not used to seeing. And that could be even one of the later stages, unfortunately. Some women also report bleeding issues, so bleeding out of the ordinary, bleeding out, after their periods, they keep on spotting, and more commonly bleeding after intercourse. And unfortunately, that is also sometimes one of the later stages that can be prevented. Having pelvic pain, difficulties when passing urine, backaches, numbness of the legs.
Cervical cancer screening is a critical tool in the fight against the disease, as it allows for early detection of abnormal cell changes that could lead to cancer.
We want women to come forth for their screening. Majority of women are still shying away from coming for screening. And yes, they only come when they are having persistent symptoms that are out of the ordinary. So we don't want you to look for the symptoms and then come for screening. Men need to encourage their wives, their mothers, their sisters, their daughters to come for screening.
Screening should start from age 25. And it's important when they go for screening in the facilities, they will get wholesome screening.
Mimi nasemanga nikisikia kwangu sasa nisikie kuna mtu anasikia mambo kama hizo, akimbia atafuta kutengenezwa kitambo, sababu itakuwa imeshishika. Sinakwambia mimi kama nikijua hiyo kitu itaniletea hiyo madhara, ningibadilisha maneno hiyo kitambo.
Coming up after the break.
A lot of young people nowadays do not seem to really mind getting HIV compared to other things that we would deem more serious.
The vaccine helps to clear the virus from the cells.
There's what we give you as the first course of medication, and if you don't respond or you're having treatment failure, then we move you to second line.
We've had some incredible stories and doctors' insights on HIV and cervical cancer, highlighting not just the challenges, but also the hope and resilience of those affected. After the break, we'll take a deeper dive into the key lessons from these episodes and what they mean for the future of healthcare. Stay with us, we'll be right back. And now for a short healthcare tip. For both HIV and cervical cancer, regular screening and early detection are key to better health outcomes. Women living with HIV are at a higher risk of developing cervical cancer due to a weakened immune system, making routine pap smears and HPV testing essential. Additionally, staying on antiretroviral therapy helps manage HIV and strengthens immunity, reducing the risk of cervical cancer progression. Prioritizing safe intimacy, HPV vaccination, and a healthy lifestyle can further protect against both conditions.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we revisited some powerful stories and expert insights on HIV and cervical cancer. Now, let's take a closer look at the key takeaways. We shall also have a one-on-one conversation with the professionals.
What I want to know is, a lot of young people nowadays do not seem to really mind getting HIV compared to other things that we would deem more serious. For instance, cancer. I mean, we even heard of a situation where teenagers saying they'd rather have HIV instead of get pregnant or something because it's expensive.
Yeah.
Is this something you've come across in your practice?
Yes, for sure. It's one of the most interesting findings. The young people, and when we talk of young, it's between 15 to 34. You find them walking around comfortable with the idea of HIV/AIDS, as long as they don't get other things like cancer, teenage pregnancies, STI, and it's very interesting. Unfortunately, that's a misconstrued fact and truth in their space, because HIV is still a very big burden. Yeah, so that they have not yet processed the end stage of the disease or how the disease progression. So for them, HIV is testing positive and starting ARVs and leading a normal life.
And with regards to prognosis, I feel like over the years people are living with HIV much longer than before. Yes. I remember when I was a child, HIV was literally a death sentence. And you would see somebody become very thin and rashes, but it's not something we really see nowadays. Yes. So what change has happened?
So in terms of prognosis, the life expectancy for those living with HIV/AIDS has increased. And in fact, the percentage of deaths, a study between 2016 report and the report in 2023, there is a 68% reduction in deaths due to HIV/AIDS.
The HPV vaccine is a vital tool in the prevention of cervical cancer.
The vaccination is being given to girls 10 to 14, and it's available in all immunizing facilities, free of charge. Yes. So the other target is now educating parents and guardians so that they are able to support. Remember, this girl, she will not make a decision on her own. So the teachers need to be informed, the parents and guardians.
The vaccine helps to clear the virus from the cells. So if someone has not had a vaccine, the virus can temporarily affect one but is shed off from the cervical cells. But when we give a vaccine, it prevents the virus from staying into the cells for a longer period of time and hence cause cancerous changes.
We have evidence from countries like Sweden that they are now getting 0 cervical cancer cases because they have vaccinated their girls. So if as a community we agreed to do this, then the cervical cancer cases we are seeing now, we would not see them in a near future.
How is HIV treated?
So first-line treatment, there's what we give you as the first course of medication. And if you don't respond or you're having treatment failure, then we move you to second line. Or maybe even if you're having an allergic reaction or for some reason you cannot take the first line, then we move you to second line. Then second line, there are different options based on what your specialist would require or feel would be necessary for somebody.
The HIV virus mutates. Mutation means that it is able to change from one form to another. And therefore it is important that everyone who is HIV positive, despite the fact that you are undetectable, prevent, that exchange of the different strains. Yes.
After we find you're positive, we'll do your viral load and we'll do your CD4, CD8. Now, as per the national guidelines, we will now decide, have you hit the cutoff? If you have, then you're a candidate for ARVs. Over the years, the cutoffs were a little bit higher, but now they've brought them down to encourage people to start ARVs when their CD4, CD8s are lower.
And how is cervical cancer treated?
Cervical cancer would be treated according to the stage of disease. And I will still re-emphasize, if we screen at a very early stage and it's in a precancerous lesion, the treatment is very simple. The surgery is a minor surgery and can be done in an outpatient setting with minimal pain and follow-up thereafter. But if it's at an advanced stage, then even surgery is not possible. We have to send a patient for radiotherapy just so as to reduce the disease level.
Today, there is treatment which is just 5 minutes treatment, and that will help prevent cervical cancer. This first-line treatment will be done even at the dispensary level. So it is that accessible to the women in rural areas. If we're asking them to go to a health facility to get screened, if they are identified with any precancerous lesions, they will be treated.
Nikunywa kemo 5. Radiotherapy nilienda 20. Na hii inaitwa braki 2. Sasa kutoka hapo nikaelekea nyumbani, hata kama nilikuwa naenda kila siku. Sasa kutoka hapo ni kwenda kuponyesha sasa mavinonda, kurelaksi, utatabika, unahara. Hiyo dawa ni ngumu sana, lakini Mungu amenisaidia, nimetomboa.
Stigma and discrimination against those with HIV continues to be a major obstacle to prevention, treatment, and support for those affected, and Rose was no exception to its impact.
Discrimination, I've seen it most in things that we do. Some of us, we do have chamas. Now when you get into a group and someone knows you get discriminated when you are known like that. But you see now when you are not known, you are okay with them because they don't know you, and that thing is not written in your, and you are healthy, you are taking your reviews privately, you are healthy. So when they know you, they do discriminate you in any other activity that they do. They assume that you shall affect them.
There's a lot of stigma. In fact, what impedes our success today is stigma that is associated with HIV and AIDS. One, internalized stigma, where the individual, they are already beating themselves, they are sentencing themselves to death. We tell a story of one person that decided that they don't want to talk to anyone, they just locked themselves in, and he lost the battle. If he was open, if he came out, he would have gotten that support.
My mother, I don't like her knowing, because she also talks too much. She doesn't care her child or not her child. So I like hiding some things from her. Yeah.
The government of Kenya has implemented several initiatives to combat cervical cancer, but there is still room for more work to be done.
There is quite a lot of work going on in terms of creating awareness at different levels in private hospitals, in the counties. But I'm still not personally seeing a big change, especially in the cities. Women are still not coming forth for screening tests, and when you ask them, and they shy away, or some of them report fear of not wanting to find out what they may be having.
When you look at 2019, we were at about 60% of screening coverage. And now we are well about that 8% in terms of screening coverage. We are not yet there, but have we made strides? Yes. We have policy documents that align to the screening and treatment of cervical cancer in this country. The other thing that the ministry has invested in is training of service providers across the 47 counties. The number may not be enough, but at least we have a level of training that has happened.
Kemo ya kwanza tulipa 10,000. Tukaendelea hivyo. Mpaka mara ngapi? Mara 5. Kile sijaona tukilipishwa ni hiyo therapy. Hiyo tulikuwa tunapeleka kakadi pale, tunapewa siku ngapi? Siku 5. Ikiisha tunarudia ingine. Kwa hivyo NSF ilisaidia mimi pande hiyo yote, lakini dawa tu ya hii misisi ndio tulikuwa tunalipa tunanunua.
Now, what advancements in HIV treatment have there been over the years?
What is available in Kenya right now are those injectables for 1 month. So you get injected, so it reduces your pill burden at home. So you don't have to keep taking a pill every day. Still under study, we have an injectable drug that is still under the final stages of implementation that now will be injected for twice a year, every 6 months. So now it will reduce those trips to the hospital and also the pill burden for taking a pill every day.
For Rose, the toughest diagnosis brought with it a silver lining. She is now part of a program called Fadhili, which offers support to those living with HIV. Her children are healthy and her family remains united.
The lady who told me what they does there, she didn't knew me. I just asked her as a friend. She's the one who brought me here. She's like my mom. So she explained to me, and I told her, can I get there? And she told me, no, you cannot. Are you like that? And then I told her, yes, I am. God did his wonders. Then I was taken to Fadhili. Then that's where we started from there. It has really helped me because in Fadhili we are being paid, as I said, we are being paid NHIF. It has really helped me because sometimes my husband, when he's sick, or my child, when he or she is sick, I do take to the hospital. I don't give any coin. My NHIF do stand for. Something else is they do pay us rent, just a small portion, but I thank God because nowhere you can get it for free. I'm really thankful to God, and because when I got married, I was worried about my children and about how will my husband take me when he knows that. But I thank God because he accepted me the way I am. Even though he is negative, he accepted me. And something else is that my child, my baby boy, is very healthy and is HIV negative. I thank God. Another thing also, this baby that I had here, baby girl, she's also good. As far as she is 7 months, she's good, and I continue thanking God and hoping for the best because at the age of 1.5 years is when I do complete breastfeeding, and I thank God, and I do hope that she'll be well. Yeah.
We aired the HIV episode in December 2024. In January 2025, the US government implemented a 90-day freeze on foreign aid, including funding from the United States Agency for International Development, USAID. This action has significantly disrupted HIV treatment programs in Kenya, which heavily rely on donor support. The funding freeze has led to the closure of clinics, layoffs of healthcare workers, and the interruptions in antiretroviral medication supplies. Consequently, approximately 72,000 Kenyans on ARV therapy have been affected, and the country faces a potential increase of 60,000 new HIV infections by 2030 due to these disruptions. This situation underscores the urgent need for sustainable, locally managed solutions to ensure uninterrupted HIV care and treatment in Kenya. Thank you for joining us on this episode of Family Health.